Now, the inguinal canal develops in both the genders, males and females. Now, at 7 weeks, the mesenchyme around the posterior abdominal wall, this begins to condense and it forms a cord-like structure, a ligamentous cord. This is the cord that I'm talking about. This is the testis. At the lower border of the testis or the lower pole of the testis, the mesenchyme condenses to form a cord, ligamentous cord. This ligamentous cord is made up of mesenchyme, mucoid extracellular tissue, and some cells, few cells. Okay. So the upper part of this cord is attached to the lower pole of the testis. This cord is called gubernaculum. Yeah, gubernaculum. The the inferior end of the gubernaculum is, to begin with, it is attached to the posterior abdominal wall, where बताते हैं, this gubernaculum, it runs caudally, it runs medially, that is, it runs caudally, it runs medially, goes round the side wall of the pelvis, around the pelvic brim, and then enters into the inguinal canal. Okay? It pierces the posterior abdominal wall, the posterior aspect of the anterior abdominal wall, and enters into the inguinal canal. Now, as it grows downwards and medially, it passes through the inguinal canal between the layers of muscles. Which muscles? It passes between the external oblique and the internal oblique muscles. As it passes through the inguinal canal, as it makes a space for the inguinal canal, it passes between the external and the internal oblique muscles. Inferiorly, the gubernaculum is attached to this structure, which is called the labioscrotal swelling. I'll go over it again. The upper end of the gubernaculum the gubernaculum is simply a cord, ligamentous cord, which is formed by condensation of mesenchyme. The upper end of this cord is attached to the lower pole of the testis or the ovary, whatever. We are talking about the testis right now. So it is attached to the lower pole of the testis, and the lower end, to begin with, is attached to the interior aspect of the anterior abdominal wall, the point where you have the deep inguinal vein. Passes through the peritoneum of the abdominal wall and then enters the two layers of muscles, internal oblique and external oblique and internal oblique. Okay. As it descends, it passes caudally and medially, running along the pelvic brim. And inferiorly, the gubernaculum is attached over here to this structure, which is called the labioscrotal swelling, something that will later on develop into the scrotum. This is the gubernaculum of the testis. Scrotal ligament के तौर पे ये एंड करेगी. अच्छा, now ये तो gubernaculum था. Now what happens is at age of 6 months of intrauterine life, the peritoneum and evagination of peritoneum. Okay, out pocketing of peritoneum. All this blue is peritoneum. Please note that this is an out pocketing of peritoneum. Now, this is the developing testis, and this black is the gubernaculum. This evagination of peritoneum is lying ventral to the gubernaculum. Okay. It is lying anterior to the gubernaculum. Okay. And it passes along the, still running anteriorly, passes along the gubernaculum, passes through the layers of the abdominal wall. It passes via the passage that was made by the gubernaculum. In other words, this gubernaculum makes a passage between the layers of abdominal wall. इस passage में से ये processus vaginalis भी pass करता है और इसी passage में से ये testis भी pass करेगा. ठीक है? Now, as this processus vaginalis, this peritoneum, evagination of peritoneum, इसको processus vaginalis कहते हैं. Now, as the processus vaginalis, as it passes through the layers of the abdominal wall, it takes the muscles and fascia of the abdominal wall with it. Okay? So, as a result, I hope you appreciate that in the inguinal canal, this testis will lie posterior to this processus vaginalis. Okay? Now, this is the developing scrotum. This is the developing scrotum. Now, please note that in the scrotum, the testis, this is the developing processus vaginalis, and this is the gubernaculum. So, please note that in the inguinal canal, in the scrotum, the testis is lying posterior to the processus vaginalis. Now, this processus vaginalis, as we discussed earlier, was simply an out-pocketing of the, or evagination of the peritoneal cavity, of the peritoneum. So it has a communication with the peritoneum. This communication normally is entirely obliterated, except for the small part bodily which surrounds the testis. I repeat once again. ये जो processus vaginalis is simply an evagination or an out-pocketing of peritoneum. Okay? This out-pocketing is lying anterior to the testis and partly surrounds the testis. Normally, this communication of the processus vaginalis with the peritoneal cavity is obliterated. Please note, you do not see any communication. Over here, you have the communication, ये communication है, but down here there is no communication because this communication normally is obliterated, except for the most caudal part that surrounds the testis that maintains or retains its uh, cavity. So now you have the processus vaginalis surrounding the testes will have two layers, an inner layer and outer layer. The inner layer would be the visceral layer, the outer layer would be the parietal layer. Okay, so let's now continue with the development of the inguinal canal. Now, as the descent of the testis takes place, as the testis descends, it takes the extensions of abdominal wall with it. As a result, so it passes through, if you remember correctly, your abdominal wall, it would pass through the fascia transversalis, through internal oblique, external oblique. These are the three layers that this the transversus abdominis does not come into this because it is a little higher. Okay? So this red is fascia transversalis. This contributes the internal spermatic fascia. Then the testis pass through the internal oblique. This contributes the premostatic fascia, and outermost the external spermatic fascia, which external oblique muscle, which contributes the external spermatic fascia to the testis. Okay. So the testis, as it descends from the posterior abdominal wall into the scrotum, it takes the covering, it passes through the inguinal canal. And inguinal canal, I told you, was the space between the external and the internal oblique. So this testis, as it passes through the inguinal canal, it takes the extensions of the anterior abdominal wall with it. So these extensions contribute multiple fascias to it. The fascia transversalis, this red line, contributes the internal spermatic fascia. The blue line, please note, this is the internal oblique muscle that contributes the premostatic muscle and fascia. And then this green line, the external oblique epineuritis. This contributes the external spermatic fascia. Okay. Now, accompanying this would be accompanying the testis are the ductus deferens. They also descend along with the testis, plus lymphatics, blood vessels, etc. All these accompanying the testis. And then, of course, all these structures are surrounded by connective tissue, which is lying in the spermatic cord. Now, after the testis enters the scrotum, after the testis has entered the scrotum, the inguinal canal, this contracts around the spermatic cord. So all these structures, they come very close to each other, closely packed, because the inguinal canal simply contracts. Now, what happens is 97% बच्चों में the testis at the time of birth is present in the scrotum. So, at the time of birth, 97% cases में children have both the testes in the scrotum. At times, what happens is the testis one on one side or the on both sides fail to descend into the scrotum. But no worry, because by the age of 3 months, most testes develop, descend by the age of 3 months. Okay? So for 3 months, there is no worry. When the testis descends, the testicular blood vessels, etc., they also develop at the level of T10, 10 thoracic vertebra. Testis develop at the level of 10th thoracic vertebra. I've already mentioned this. The blood vessels of the testis also develop at the same level. And as the testis descends, I just mentioned it earlier on, the blood vessels of the testis also descend with the testis. अच्छा जी, अब जो testicular descent है ना, that takes place in two phases. The first phase is between third to 12 weeks, and it ends at the time when the testis comes to lie at the deep brain, deep inguinal vein. Now, this descent of the testis is associated with the fact that testis, as time passes, it grows in size, it enlarges in size. So that calls for, besides, we mentioned earlier on that the testis was developed in the vicinity of the mesonephros, that was the developing kidney. The mesonephros, if you remember, degenerated. Pronephros, mesonephros degenerated, only the metanephros was left. ठीक है, कुछ ducts mesonephros की रह जाती हैं, but by and large, the mesonephros degenerated. So atrophy of the mesonephros plus the enlargement of the testes, both these factors contribute to, is associated with the descent of the testes. Besides, one more factor is that the paramesonephric duct in the males, that undergoes atrophy. Paramesonephric ducts atrophy कर जाती हैं. Why? The growth, ये जो Mullerian inhibiting substance है, ये release होता है, and this inhibits the paramesonephric duct to grow. So, under the influence of anti-Mullerian hormone, yeah, Mullerian MIS is Mullerian inhibiting substance. Under the influence of this, the paramesonephric duct, that atrophies. Because paramesonephric duct is the duct that forms genital ducts in females. Mesonephric duct contributes to the formation of genital ducts in the males. So paramesonephric duct has to, it should atrophy. So under the influence of Mullerian inhibiting substance, also called the anti-Mullerian hormone, the paramesonephric duct atrophies. Besides, it processes it. This also enlarges, it elongates, it passes through the inguinal canal. So all these factors contribute to the descent of the testes. So besides, अब ये जो glutenaculum है, which was attached to the lower pole of the testes, this begins to shorten. It begins to contract, it begins to shorten. As it begins to shorten, it would become thicker, wider and thicker. When it becomes thicker, obviously, as it is passing between the layers of the abdominal wall, as it passes through the inguinal canal, and it becomes wide and it becomes thick, it will also increase the size or increase the diameter of the inguinal canal, and that increase in diameter of the inguinal canal will promote the testis to come down into the inguinal canal and then come down into the scrotum. So by 26 weeks, the testis is still at the deep ring, and then it begins to come down. Now, the descent of the testis is also promoted by the change in position of different structures. एक तो ये कि the pelvis enlarges, it grows caudally, the trunk enlarges, elongates, and it grows cranially. ठीक है? Pelvis enlarge करेगा, it will grow caudally, trunk elongate करेगा, it will grow cranially. Another factor that promotes the descent of testes. ये first phase था. Second phase में अभी तक I told you the testis is at the deep ring. Second phase में the testis passes through the inguinal canal. ठीक है? ये 7th month पे होता है. अब इसमें multiple factors हैं. एक तो gubernaculum जो है, I told you it becomes thicker, it becomes shorter, it loses its mucoid material, it loses its cellular factors. ठीक है? And this gubernaculum then pulls as it shortens, it pulls the testis down. Besides, the second factor is that testis, I told you, was developing in the abdomen. Now, different viscera begin to develop in the abdomen. As the viscera develop in the abdomen, the space in the abdomen decreases, intra-abdominal pressure rises. As a result, the testes are pushed down. Okay? Then, another factor, testis produces hormones, testosterone, produced by interstitial cells of Leydig. The other day we discussed this. Plus other androgens, they are also secreted. They promote the descent of the testis. This little gubernaculum that is left after the descent, the gubernaculum, it has pulled the testis down. Now whatever is left in postnatal life, simply ligament of the scrotum pus. By 9th month, the testes are in the scrotum, or they should be. In 97% of cases, I just mentioned that the testes at the time of birth are present in the scrotum. Only 3%, full-term babies may, only 3% of cases, 3 to 4% of babies have one or both testes in not present in the scrotum, anywhere else, but not in the scrotum. इसको undescended testes कहते हैं. If one or both testes fail to descend, इसको cryptorchism भी कहते हैं. या Y नहीं, या T होना चाहिए. Cryptorchism. यहाँ पे T होना चाहिए. ठीक है? Cryptorchism भी कहते हैं. और undescended testes. Premature babies, 30% of premature babies have undescended testes. Mature full-term babies में only 3 to 4%. उनमें से भी 3 months में generally the testes descend कर जाते हैं. Whatever is left up to 1 year of postnatal life, the testes should be in the scrotum. If the testes after 1 year of age, if they are in the abdominal cavity or anywhere other than the scrotum, out of the scrotum, चाहे वो abdominal cavity में हो या inguinal canal में हो, anywhere, the testes which is not in the scrotum after 1 year of life, then it will fail to mature. If mature नहीं करेगा तो it will produce sterility. ठीक है जी? Now let me show you sites where abnormally descended testes are present. This is the deep ring, the superficial ring, then it could be over here at the immediately inside the deep ring, and this is anywhere in the abdominal cavity. Okay? Now it is very important that we correct this undescended testes. If the parents bring the child very late, say 2, 3, 4 years, they were still waiting for the testes to come down, or they were unable to locate the testes at all, because if the testis develops in the abdomen and it remains in somewhere in the abdomen, obviously the parents will not be able to feel the testes, palpate the testes. Okay? But still, that testis has to be operated upon. It has to be either brought down or removed, because if it is not removed and if it is not in its correct position, then this undescended testis is liable to undergo a tumor. It gets converted into a tumor which is called germ cell tumor. It is a malignant tumor. So undescended testis is allowed to remain outside the scrotum after 1 year of life, is liable to develop into a germ cell tumor. So it is very important to save the life of the child and bring the testes down, out of the abdomen or wherever site it is located at. Now, usually the cryptorchid testes or undescended testes is in the inguinal canal. ठीक है, over here. ये deep ring है, ये superficial ring है, usually inguinal canal में ही होता है, and generally it can be brought down without much difficulty. ठीक है? But if it is in the abdomen or anywhere else, then obviously it is not easy to bring it down. Why doesn't the testis descend? Nobody really knows. The causes are unknown. However, it is said that a deficiency in the androgen hormone deficiency, that would promote the undescended test. That could be the reason for, because it is the testosterone and other androgenic hormones that are responsible for the descent of the testes. ठीक है? अगर ये androgens नहीं होंगे, तो testes will fail to descend. Now, एक तो now ectopic testes की size क्या है? एक तो undescended हुई ना, कि वो descend ही नहीं की. The second condition is that on its way down into the scrotum, that deviated to some other point. Now, what happens is that the gubernaculum, as it brings the testis down, the part of the gubernaculum may pass to an abnormal location. यहाँ से सीधा चलता चलता वो इधर चला गया, या नीचे आ गया, साइड पे आ गया, कहीं भी ऑपोजिट साइड पे चला गया. ठीक है? In this case, most of common site जो है ectopic testis की, वो है इसको हम interstitial testis कहते हैं. This is between the layers of the abdominal wall, external to the epineuritis of the external oblique. यहाँ external to the epineuritis of the external oblique. ठीक है? इसको interstitial type of testis कहते हैं. Then you have this medial aspect of the thigh, upper part, proximal part of the thigh, medial aspect. ठीक है, dorsal to the penis, crossed over to the opposite side, so cross ectopia कहते हैं, or it could be in the perineum. ठीक है, this diagram is taken from your KLM, बहुत अच्छा दिया हुआ है इसमें. There's one more condition, congenital inguinal hernias. ठीक है, फीमेल्स में ज्यादा कॉमन होता है. Now what happens is कि ये जो tunica vaginalis था ना, normally हमने कहा कि वो obliterate हो जाता है, but if it fails to obliterate, तो ये जो opening है इसकी tunica vaginalis, it continues to communicate with the peritoneal cavity. अब peritoneal cavity में दूसरा पड़े हुए small intestines हैं, ठीक है. So if the processus vaginalis is persistent, a loop of intestine may pass into this processus vaginalis and it may descend down into the scrotum or the labia major. I repeat once again. ये जो processus vaginalis था, that fails to obliterate. Scrotum में तो वैसे ही normally patent रहता है surrounding the testes, this area में. But above this in this area, it should normally be obliterated. ठीक है. अच्छा. And if it remains patent, then a loop of intestine or any other vessel of the abdomen may pass into this patent processus vaginalis. ठीक है. This thing is common in males. कोई ऐसा uncommon चीज नहीं है, और it is associated with undescended testes, and it is even commoner in females. Now, if this is the processus vaginalis, ठीक है, this remains patent, open है, communicate कर रहा है with the peritoneum, but it is not wide enough to allow the intestines to enter into it. So what happens is the lining epithelium जो है, that will secrete fluid, the peritoneal fluid will enter it, and this patent processus vaginalis is filled with fluid. So a fluid-filled processus vaginalis that surrounds the testis, this condition is called hydrocele, a scrotal hydrocele. Okay? When fluid enters the patent processus vaginalis, this is the open or patent processus vaginalis, peritoneal fluid enters into it, so it dilate kar diya, and obviously this surrounds the testis. This is the testis, this is the gubernaculum. So the two layers of the processus vaginalis fill with the cavity of the processus inside the processus vaginalis filled with fluid from the peritoneal cavity. This condition is called hydrocele. Now at times what happens कि ये तो normal है ना कि tunica vaginalis, which is remains of processus vaginalis, covering the encircling the testis on the anterior aspect. ये जो rest of the processus vaginalis, this part, it normally should undergo degeneration. Lekin at times what happens is obliterates in the upper part, obliterates in the lower part, in the middle part it remains patent. it becomes fluid filled because ये जो lining epithelium है, this secrete fluid, this patent processes vaginalis, this is filled with fluid. Now this is another kind of hydrocele, which is called hydrocele of the spermatophore. This is the hydrocele of the spermatophore. Actually, so ये तो हमने कर लिया. Before we go on to the development of the ovary, thank you, Ramzan Mubarak, to all of you. Now, any questions regarding the development of inguinal canal? Yeah, anomalies of the testes. Do we have any questions before we go any further? No? No questions? Okay, that's very good. Hanji, descent of the testes. Okay. What about descent of the testes? Do you want me to repeat it? Yes or no? Hanji, go ahead. Brief review दे दो. Okay. ठीक है. I'll do it for you. No problem. Anything else? Anything else? Anything else? If I quickly go over the descent of testes. Then, अच्छा, चलिए, let's go back. अच्छा जी, so inguinal canal को हमने develop कर दिया. Inguinal canal the factors that contributed to the formation of the inguinal canal was number one, the gubernaculum that developed, and then it passed through the layers of the anterior abdominal wall, namely the external and the internal oblique muscles. And this gubernaculum actually made a path, या रास्ता बनाया था इस gubernaculum ने or the other structures to pass. Okay? So it made a path or it made a way in between the layers of the anterior abdominal wall. Now what happens is the testis begins to develop. I told you the testis develops at the level of T10 on the posterior abdominal wall. It develops in two phases. First phase is between 3 to 12 weeks, and this phase ends when the testis is at the level of the deep ring. Now, why does the testis develop? Descend? क्यों descend करता है? एक तो ये कि the testis enlarges in size, needs more space. Abdomen में इतनी space नहीं है, so it comes down. Testis comes down. दूसरा, if you remember correctly, testis develops in the vicinity of the mesonephros. Mesonephros was a developing kidney. So ये developing kidney जो है ना, mesonephros, ये degenerate करता है. Pronephros and mesonephros degenerate. This stimulates the testis to go down. Plus one more thing, paramesonephric ducts, वो भी इसके साथ ही थी, वो भी degenerate कर जाती हैं because Mullerian inhibiting substance या anti-Mullerian hormone secrete हो रहा है. Because of this hormone, ये जो Mullerian duct या paramesonephric duct जो है, ये it is very important for the paramesonephric duct to degenerate. The reason is paramesonephric duct forms the genital ducts in females. Males में mesonephric duct forms the genital ducts. Females में it is the paramesonephric ducts that form the genital ducts. Okay? So they have to regress or atrophy in the males. And this atrophy of the paramesonephric duct is carried out under the influence of Mullerian inhibiting substance या anti-Mullerian hormone जो हमने कहा था कि Sertoli cell से secrete होता है. So all these factors are associated with descent of the testes. So एक तो testis का size enlarge कर जाता है, mesonephros की atrophy हो जाती है, plus paramesonephric duct जो है वो atrophy कर जाती है because of the secretion of anti-Mullerian hormone. उसके अलावा the other factors is कि ये जो gubernaculum है, this shortness, ये gubernaculum which is attached to the lower pole of the kidney, वो ligamentous structure जो था which was made up of mucoid connective tissue with cells, ये this was the structure that made way between the layers of the anterior abdominal wall and created a pathway called inguinal canal और उसमें से ये processes vaginalis भी गुजरा और उसमें से testis भी गुजरा. ठीक है. So this gubernaculum shortens. जब short होगा तो thick हो जाएगा. जब thick होगा तो it will make a space in the inguinal canal and through that space the testis passes. 26 weeks पे the descent of the testis is as far as the deep vein. ठीक है. और ये जो positional changes हैं ये इसलिए भी अब later on होती हैं because the pelvis enlarges and it moves caudally, the trunk elongates and it moves above superiorly, cranially. Because of these change in the sizes, the testis comes down. अब second phase में first phase के end पे the testis was at the deep vein. Second phase में the testis passes through the inguinal canal. ये सारा ये ठीक है. अब इसमें few factors contribute to it. एक तो वही कि gubernaculum becomes shortened, loss of mucoid tissue. ये देख लीजिए अब this gubernaculum has been reduced to this size. ठीक है. उसके अलावा अब abdomen में other structures develop in the abdomen. Mainly the abdominal viscera develop in the abdomen. So intra-abdominal pressure and they push the testes down. Plus the testis now begins to secrete testosterone and other androgens. These hormones are secreted by the Leydig cells of the testes and they stimulate the testis to descend and come to lie in the scrotum. Gubernaculum आप ये देख रहे हैं. This caudal-most part of the gubernaculum persists. It is attached to the scrotal skin as a ligament with the scrotum. So by 9 months, the scrotum should be in the testis should be in the scrotum. I hope you have understood. Any other question, beta? Okay, you're very welcome, my dear. You're very welcome. Any other questions before we start with the development of the ovary? Okay, नहीं है तो ठीक है. For those who are listening, आधे तो मेरे ख्याल में अभी तक सो रहे होंगे. एक्सक्यूज ये है कि रमजान है, सहरी पे उठे थे, नींद नहीं पूरी हुई, एक्सेट्रा एक्सेट्रा. नेवर माइंड. ओके जी. Development of the ovary. Ovary slowly develop करते हैं and by 10th week it is distinguishable. इससे पहले वो नहीं, you cannot see the ovary. Ovarian development X chromosome पे dependent है. X chromosome पे there are genes on the X chromosome that help in the development of the ovary. Besides autosomal chromosomes में autosomes उन पे भी genes हैं. They also have a role in the development of the ovary. So it is not just X chromosomes, it is also the autosomes. Genes or the autosomes, they also play a role in the development of the ovary. This is something that you do not see in the testes. Testes में सिर्फ Y chromosome का होता है. Okay, now let's do the development of the ovary. Sex cords हमने बना दिए. हमने कहा था surface epithelium थी that penetrated deep into the connective tissue of the developing gonad. ठीक है? और उस developing gonad में males में it was the medulla that was developing very rapidly. Surface पे जो cords थे they degenerated और एक thick tunica albuginea बन गया. Now what happens in the females? Sex cords, yes, they do penetrate into the medulla, and this connective tissue से you have cells that develop into cords, and these cords anastomose with each other and make a rudimentary type of rete ovary. जिस तरह rete testis बना था males में, यहाँ पे rete ovary बनता है, but these primary sex cords plus this rete ovary, all these structures degenerate. Okay? They degenerate and convert into fibrous connective tissue, vascular connective tissue. This vascular connective tissue is forms into the medulla of the ovary. So medulla of the ovary just contains connective tissue with blood vessels. वो जो है degeneration of rete ovary plus the primary sex cords वो degenerate करते हैं. Now, after the primary sex cords, the secondary sex cords form. बिल्कुल in the same way. Now, these secondary sex cords, they contain primordial germ cells. वही germ cells जो migrate किए थे from the epiblast into the endoderm of the yolk sac, and then along the allantois, along the dorsal mesentery of the gut to the gonads. ठीक है? These come to lie in the developing gonads, and they enter into these sex cords. When they enter into the sex cords, each primordial germ cell is surrounded by a cell cluster, a layer of cell. The center में this is germ cell and this is the cell cluster. ठीक है? Now, to begin with, large number of these cells, they are surrounded by a single layer. A group of cells is surrounded by a single layer of flattened epithelium. Okay? So these germ cells surrounded by flattened epithelium to begin with. Then around in this time, as these cluster of germ cells, they are surrounded by a single layer of epithelium. Germ cells, they undergo mitosis, rapid proliferation. ये जो ओगोनिया जो है, इनको जर्म सेल्स पहले कहते थे, नाउ दे आर कॉल्ड ओगोनिया. They undergo rapid mitosis. So by the 16 weeks, each ogonium is surrounded by a single layer of epithelial cells. ये देख लीजिए. Every ogonium is surrounded by a single layer of epithelial cells. Now this structure, an ogonium या आप इसको primordial germ cell कह लें, surrounded by a single layer of epithelial cells. This structure is called primordial follicle. ठीक है? Ogonium surrounded by a single layer of flattened epithelial cells is called primordial follicle. Now all these primordial follicles, they remain in the cortex. The cortex becomes very thick. ये देख लीजिए. It's a thick cortex. The surface epithelium is a layer, single layer of tubercle cells. ठीक है? ये यहाँ पे. This single layer of tubercle cells is separated from these cells in the cortex by a very thin fibrous connective tissue layer, which is called tunica albuginea. So tunica albuginea females में भी develop तो होता है, ovaries में भी develop होता है, but it's not as well developed and thick as we saw in the testes. Testes में तो it was tunica albuginea. Development of tunica albuginea was the hallmark of the testes. यहाँ पे नहीं है. अब ये जो females में ये जो single layer of tubercle cells है, this become continuous with this mesentery, mesothelium जो है, जो mesovarium है, अभी आगे चल के mesovarium भी डिस्कस करेंगे. Now as this ovary, as it enlarges, it separates out from the developing mesonephros. As it is separating from the mesonephros, it remains attached to the posterior abdominal wall by these layers of peritoneum. This develop into mesovarium. So the mesentery of the ovary, by which it is attached to the abdominal wall, that is the mesovarium. ठीक है? अब ये जो primordial follicle था, after it undergoes first meiotic division, it gets converted into. जी बस मैं 5 मिनट. ठीक है? Okay. By the 5th month of intrauterine life, you have around 7 million follicles. Majority of them degenerate, and at the time of birth, only about 2 million follicles remain. Puberty weight, a female has around 40,000 follicles, and out of these 40,000 follicles, only approximately 400 follicles are ovulated. The rest all remain over there, and they undergo degeneration. Okay, I think I will not do this with you. There is very little time. Yeah, problem होगा. Do you have any questions as far as the development of the ovary is concerned? Any question, beta? नो क्वेश्चन, सारा समझ में आ गया ओवरी की डेवलपमेंट. Okay, then Tuesday को तो you have a substage coming up finally, fourth substage Tuesday को है inshallah, and you also have a final stage coming up week after that. I think it will be the 5th of May or something. Okay. And Monday say inshallah, coming Monday, day after tomorrow, we will start your next region, which is head and neck. So Monday को inshallah we'll start with head and neck. Okay. Tuesday को you have a substage, and after the substage, week after the substage, that is on the 5th, Tuesday. Okay. Next Tuesday, inshallah, you will have your final stage. Final stage में सारा abdomen, सारा pelvis, whatever I've taught, सारा, that is included in your final stage. परसों की substage में, Tuesday की substage में, you only have the pelvis and the perineum. ठीक है? Any questions regarding this then? Any questions regarding your substage or your final stage? नहीं है? Okay, because now you'll see me on Tuesday. I won't be coming on Monday. So since there are no queries, I wish you all the very best of luck for your sub-stage. And then, बाकी final stage की तो good luck बाद में wish करूँगी. ठीक है जी? So, good luck for your sub-stage. Okay. God bless you all. और प्लीज रमजान को अपना एक्सक्यूज ना बना लेना कि जी रमजान था तो हम पढ़ नहीं सके और रमजान था तो ये रमजान इज नो एक्सक्यूज बिकॉज we are the descendants of people who would be fasting and they would be fighting wars, riding horses in a war, and they would simply take out their dates from their bags and break their fast at the time of Maghrib. So you should not be making any excuses. I wish you all the very best of luck and see you next time with your new region, which is head and neck, inshallah.